I'm grateful for this opportunity to speak with you and to share my passions in working with people living with back pain and in refining rehabilitation approaches that are tailored to each person's unique experience with pain and movement. My intentions are to share a few highlights on the benefits of a mindful movement practice, to guide you through a meditative movement sequence, and to share some of my clinical and research interests. Buddhist practice and other spiritual disciplines place a strong emphasis in being centered in the body because it's known to lead to greater self-awareness. Meditative movements like Tai Chi and yoga hold therapeutic value in that they can increase our ability to sense more discriminate movement, to increase our access to internal body signals like the flow of our breath, and optimize activation of our trunk muscles, which support our spine. These are all effects of high interest because each of these features is known to be impaired when pain becomes persistent. And pain science supports this philosophy. Excuse me. So, how do we cultivate this skillful, mindful attendance to our body's sensations and movement? Well, over the next few minutes, I'll be guiding you through an example of this practice. But before I begin, I'd like to offer you a few helpful attitudes to approach this practice. The first is less is more. The smaller and slower your movements, the more likely you are to learn from your body. So finding that zone where you feel confident, yet able to explore the edges of your movement with a beginner's mind. Second, there's no right way, there's just the right way for you. If you're not able to perform the movement that I'm demonstrating, consider a smaller version of that movement or visualize the movement. Third, be flexible with your thoughts about movement. Movement is often one of the first aspects of our lives that we attempt to control when we have pain. And it's normal to sometimes develop beliefs and behaviors that certain movements are harmful or to be avoided. And while this may be an effective short-term strategy, in the long term, it can prevent our ability to restore our physical health. So if you have, or if negative thoughts arise during this guided movement practice, I invite you to detach from them for the time being. So let's begin with drawing awareness to our posture while we're sitting. And place one hand on your belly and the other hand on the arch of your lower back. And we'll start at the foundation of our body, the pelvis. So roll your belly forward and feel the belly move into your palm and the arch of your back move away from the back of your hand. Explore with rolling your pelvis backwards and feel the arch of your spine move into the back of your hand. Find that middle space where you feel most balanced and your pelvis and back feel most supported. Now place one hand on the top of your chest and lift your chest up towards the ceiling. On your inhale, and keep your chest drawn up as you exhale and strike your best superhero pose. Now, place one of your hands at the base of your head, and with your other hand, place your fingers underneath your chin. Draw your chin in towards your throat. Feel your neck lengthen, and the base of your head lift up towards the ceiling. Place your hands down at your thighs, and focus your attention to your breath. Where do you notice the sensation of the breath most prominently? Is it your nose? Is it your chest? Is it your belly? place your hands on your belly and your lower rib cage and feel the subtle rise and fall as you breathe in and out. Repeat this a few cycles. Feel the entire breath as it enters your nose and your lungs to the time it exits your body. I invite you to come up to standing. And if you'd like to remain sitting, you can also perform the movements there as well. Keep your feet hip-width apart and stand upright but at ease. On the in-breath, bring your arms up to shoulder level, and on the exhale, press your arms down towards the floor. Repeat this a few cycles. Breathing in, breathing out. Sense the rising of internal energy as you raise, and the lowering of your internal energy as you lower. Breathing in and out. Place your arms down at your side. Shift your weight onto your right leg and touch your left heel forward in front of you. Bring your arms in front and shift your weight and touch your toes behind you. Repeat this a few cycles, flowing between forward and backward, breathing in and out, and switching sides. Shifting onto your left leg, feel the subtle weight shift. Touch forward, tap back, forward, and back. Place your arms at your side. Now imagine you're holding a light, large ball in front of you, and float the ball over to your right. When you reach the end, rotate the ball and reverse directions over to the left. Feel your hips rotate as you turn. Feel your trunk muscles engage as it supports your spine. Breathe in, breathe out, and return to the start position. Make a light fist with your hands and place them at your hips. Shift your weight onto your right leg and touch your left foot to the ground as you punch forward with your right hand. Reversed, shift back and alternate to your other side. Forward with your right, punching with your left, and alternate sides. Feel your arm and legs support your balance as they engage. Keeping your feet hip-width apart, bring your right leg forward far enough that you can bend your right knee. Bring your hands to your heart and straighten your knees and feel the stability of your body in this as you strike the peaceful warrior pose. Bend your right knee, open your hands out as if you're peeling back a set of curtains, and feel the strength of your body in this pose as you assume the courageous warrior. And cycle back, straightening your knee, coming forward as you bend, opening, closing. Feel the shift of your body as you move and cycle between these two poses. Switch sides, bringing your left foot forward. Flow between the two poses, breathing in, breathing out. Okay. Now, bringing your feet together and your hands at your heart, feel the grounding of your feet and sense the breath at your heart, where your hands touch your heart as you assume the mountain pose. Breathing in and out. And I invite you to return to sitting. And as you are sitting and drawing attention to your posture, draw awareness to any sensations in your body of warmth or tension or ease. If you're experiencing pain, are you able to simply observe it or notice the change in sensation? While it's normal to draw our attention away from pain, it's only in feeling and knowing these sensations that we're better able to relax, to soften, and to move with greater ease. Mindfulness is bodyfulness, and bodyfulness is mindfulness. Much like the keel or the rudder on a boat that prevents the oarsman from being blown sideways, being centered in our body can provide us with the place of balance. And I'd like to leave you with one of my favorite metaphors, and that is to consider your body your home. Your home is a place where you can be yourself. Your home is a place where you can take refuge. Your home is a place where you can be most comfortable. So I invite you all to stay home and to see what unfolds. As a clinical and research physiotherapist, my path is in understanding how pain and posture and movement are impacted with people with back pain in an effort to refine rehabilitation to better monitor and promote positive outcomes. My PhD work investigated multiple movement-based classification approaches for back pain. And what I discovered was that while these approaches were effective in identifying and treating the movement aspects of pain, many did not adequately address the psychological aspects. And so because of these findings, I became interested in learning more holistic approaches to care. And during my postdoctoral journey, integrating different forms of pain education and self-care training, and incorporating these elements, as well as my own practice in yoga and Tai Chi and meditation, into my clinical and research efforts. So if you're presently suffering from back pain and think that a pain education, a self-care training, and a movement-based approach may be helpful for you, I invite you to contact me and our physical therapy team to see if one of our ongoing pilot studies may be a good fit for you. I'd like to thank you for your attention and allowing me to share my practice and my thoughts with you, and I hope you found it to be of value.
Time for a few questions.
Oh, okay. Yes, we have time for a couple questions.
How do we get to see you? Can you repeat the question, Nick?
Yeah, so the question is, how do we get to see you? Well, of course, we'll talk about this at the end with the Q&A, but the laboratory, the Systems Neuroscience and Pain Laboratory, is where I'm doing my postdoctoral work, and through the Stanford Pain Management Center is where we see patients with chronic back pain, and Stanford Pain Management Center. The clinic is the Stanford Pain Management Center, yeah, where we treat patients with pain. Children, no, it's primarily adults that we see for our care.
Could you repeat the question, Nick, please?
Yes, the question was, do we see children, pediatric patients with pain as well? And the answer to that, at least in the Pain Management Center, and many of our studies are primarily focused on treating adult pain. However, there's, Beth or Sean can speak to this, but Stanford, the Lucille Packard does have a pediatric pain treatment center. How about back here? The woman here in the back with her hand. Yes, you.
Yeah, we can't really see them.
My question is, do you plan to bring in Alexander technique to the study and introduction to the pain management? Thank you.
Yeah, Alexander technique. So the question was, do we plan to bring in Alexander technique, which is a form of body awareness, much like Feldenkrais awareness therapy. We have had some studies, some pilots with some Feldenkrais awareness through movement training, and have a great practitioner for that. We have yet to look at Alexander technique as a treatment or research program. But thank you
Nick,
for the question.
Could you please take one up at
Yeah.
the top? I think they're.
Thank you.
Okay.
Were the movements you just showed us, was that considered Tai Chi, or was that a combination of yoga
Yeah,
and Tai Chi?
the first part was Tai Chi, and then the second part was maybe what you would call slow flow yoga. Sure, yes. Yeah, in my previous time as a clinician, have had that opportunity to work in aquatic therapy, and it's a wonderful environment for people to get into, to transition to more land-based programs. There are several warm water pools in the Bay Area. We have resources for that if that's of interest to you.
How do you feel about the connection between meditation and back pain? You know, curing back, helping with back pain.
The question is, repeat the question, what are my thoughts on how meditation can be helpful for easing back pain? And I guess my answer would be that I think it can be very powerful in changing your relationship with pain. I think it can help with the suffering that's associated with back pain. So getting back to that point of just becoming more in contact with the feelings of sensation and noticing the impermanence of those sensations sometimes, or the alterations of those sensations, can be very powerful for many people. Should I keep going here? Okay, one more. Great, excited for all the questions. How about here? Do you have a microphone? You have a microphone right behind you? Can you use the microphone?
Okay, hi. So I'm a stage 4 cancer survivor. Started a project to help cancer patients do dance, do a live video platform we built. There's a research published in 2013. It's a review of 27 studies shows creative arts therapy improve quality of life for cancer patients by 50% and reduce pain by 59%. The pain data is especially impressive because initially it was 54, and then in the follow-up it went up to 59. So I'm very curious, you mentioned you have a lot of extensive study in your PhD looking at different modalities. And do you have any interest or have any practice in that?
I do. So the question was, I guess, related to the topic of dance therapy and the therapeutic value of dance for the treatment of chronic cancer pain. And yeah, I think that's a very interesting topic to explore. In fact, I actually am speaking with one of the pain psychologists in Lucille Packard, who does use dance therapy for a lot of the pain patients. But I'm interested in seeing how it works with adult chronic pain and back pain. So yes, I think it's a very interesting topic.
Great. You can see the interest that we're getting. We're going to keep moving along, and then hopefully we can get Dr. Karayanis back, and we'll do, if we can make it all come together, which I think we can, another panel Q&A a little bit later. So warm thank you to Dr. Karayanis.